I'd like to welcome everybody to the Zoom meeting tonight. ASD, the tip of the iceberg, what might be going on, what else might be going on. I am just so thrilled to have as our speaker tonight, Julie Steck. I've known Julie for many years. I revere Julie. I have to tell you, and I know that I'm not supposed to say this, but when I've had personal issues of relatives that have needed assessment, my go-to person is always Julie. We are so blessed to have her in the state of Indiana. She's with the Children's Resource Group and is really a pioneer in this state. So take it away, Julie.
Thank you, Kathy. You always humble me when you say those things. And I just think that really for all of the people at IRCA, we've been in it together for a long time. And autism is certainly a field that we knew little about when I first started in the field 40 some years ago. And in many ways, we still know little about. But I want to thank all of the families and professionals who are on tonight for taking time to be with us. Well, one of the things that I often find when I see a young person with autism spectrum disorder, whether it's a young child or a school-age child or an emerging adult or an adult, is that there are often conditions that are underlying the autism that have not been identified. And oftentimes those are a piece of the puzzle that are causing some difficulties and people are struggling to understand. So one of the things we're going to talk about tonight is how important it is to recognize and treat the underlying conditions. We obviously won't be able to go into every condition that coexist with autism, but I want to talk about tonight about a few of the underlying or coexisting conditions that are often involved with autism. So one of the things that I say often, and so if you've heard me talk, you may have heard this, but the diagnosis of autism spectrum disorder should not be just a yes or no question. It really should be a question of what is the nature of the problem and what else is impacting the individual. So I've been involved as a psychologist diagnosing autism and working with families for going on 4 decades. And I will say that when families call our office or a family talks to me about their concern, and they start out with, I think the child has autism. Sometimes they do, and sometimes they don't. But there is often more going on than just autism. So one of the things we know is that if an individual has one neurodevelopmental disorder, they are at greatly increased risk for other neurodevelopmental disorders. So in this case, we're talking about autism spectrum disorder. And so if an individual has autism spectrum disorder, they are at higher risk than the general population for intellectual disability, for tic disorders, for learning disorders, for ADHD, and for language disorders. So when we talk about that iceberg, it is very likely that underneath the tip of the iceberg will be another coexisting neurodevelopmental disorder. There are often coexisting or co-occurring medical and psychiatric conditions. And so this diagram just shows a number of the various coexisting medical or psychiatric conditions: obsessive compulsive disorder, anxiety, depression, psychosis, Down syndrome, Fragile X, tuberous sclerosis, seizure disorders, ADHD, and tics. So that's just a sample of the medical and psychiatric conditions that often or can coexist with autism. In today's age, where many families are getting genetic testing that will reveal a wide range of genetic conditions or chromosomal abnormalities that may be associated with autism. So think of those genetic or chromosomal conditions as part of the neurodevelopmental disorder or the sequence that includes autism. It doesn't mean they don't have autism, but it means that they may have this may explain the cause of the autism and the other conditions. So what we are learning is that the rate of virtually every psychiatric condition is greater in the population of those with ASD than in the general population. And I've just chosen a sample of several psychiatric conditions to show you the comparison. So if you look on these graphs, the blue pillar is showing us the frequency in the general population, and the orange is telling us the frequency of that condition in the population of those with ASD. So for example, any anxiety disorder, it's very common in the general population. So about 25% of children and adolescents will have an anxiety disorder over the course of their childhood or adolescence. But in the population of autism, it's at least 40%. And I'm saying at least 40% because in my experience, the rate of anxiety disorders in those with autism spectrum disorder is probably higher than 40%. ADHD is probably far more common than most people realize or believe, but it's prevalent in at least 10%. This is a little bit low estimate of the general population, but ADHD and related deficits in executive functioning present in at least 30% of those with autism spectrum disorder. Bipolar disorder is found in only about 2% of children and adolescents in the general population, but probably more like 7 to 8% in the population of individuals with autism spectrum disorder. What we're learning is there is a common genetic pathway that we don't fully understand yet that links ADHD, bipolar disorder, and autism, as well as possibly schizophrenia. So in the general population, schizophrenia accounts for 1 to 2% of the population, but it's slightly higher in individuals with autism spectrum disorder. So this graph, this slide is really just meant to illustrate that the likelihood of an individual with autism spectrum disorder having a common coexisting psychiatric condition is greater than in the general population. So why should we identify coexisting conditions? And I had to sit back and ask myself that. I'm going to do this presentation about coexisting conditions with autism spectrum disorders. Obviously, it's important to me, but why is it important for us as parents, professionals, educators to identify coexisting conditions? Well, first of all, we all know autism spectrum disorder is not a one-size-fits-all diagnosis. And I think I've heard Kathy Pratt say many times, if you met one person with autism, you've met one person with autism. And I couldn't agree more. The coexisting conditions help us to identify and differentiate our treatment and identify the needs. Secondly, the core symptoms of autism spectrum disorder are very difficult to treat, but there are often known interventions that are very effective in treating and addressing the coexisting conditions. So, for example, we know there are treatments for anxiety. We know there are treatments for depression. There are treatments for ADHD. There's intervention for a specific learning disability, such as dyslexia. So we can intervene with the coexisting conditions and see perhaps more success than trying to address the core symptoms of autism. And we know that understanding the coexisting conditions is critical in considering medication and in educational planning. So I cringe when people say, well, it doesn't matter what you call it. Well, in some ways it does, because it helps us to know how we're going to intervene and treat and making good decisions, whether it's for medication or therapy or educational programming. So I've already alluded to the fact that I've been around a while. And when I was doing my training early on, we used to think in boxes. So we would sit at a staffing when I was going through my training, and the question would be, what is it? Does this child have autism? Does this child have obsessive compulsive disorder? Does this child have ADHD? As if we found the right box, then we were good to go. Well, what we've learned over time is that we need to think in Venn diagrams. We need to think in terms of overlapping conditions that impact each other. And it's the combination of the challenges that help us to better understand the individual. So it's not, which one does this child have? It's what combination of issues does a child or adolescent or adult have? So what I'm going to do is talk a little bit about the most common conditions that coexist with autism spectrum disorder. So I would say that probably I'm going to talk about two of the most common, ADHD and anxiety. So when we talk about attention deficit hyperactivity disorder, most people immediately think of a child who can't sit still. And I do think there are many young children and maybe school-age children with autism who struggle to sit still, but that's not all the ADHD. Some of that's impacted by just the autism spectrum disorder. But ADHD is really involves deficits in executive functioning, the ability to remember what to do when they need to do it, the ability to plan, the ability to organize their thoughts, their ability to think about the impact of behavior and inhibit it. So there are many more aspects to executive functioning, but think of ADHD as not just hyperactivity, but really deficits in the ability to plan, organize, think ahead, reflect on the past, manage, adjust their behavior to the situation. So autism spectrum disorder, ADHD frequently overlap. And I usually say to myself when I'm doing a diagnostic evaluation is I need evidence that there is not ADHD. Because if there is any element of ADHD, that's going to help us implement programming, help parents better understand the child. And maybe it means medication, but mostly it means factoring the deficits in executive functioning into our approach to that individual. And so if you have autism spectrum disorder and ADHD, how about anxiety? That is probably the other most common co-occurring condition. Um, Now, individuals with autism don't necessarily demonstrate anxiety in the way that people without autism spectrum disorder do, but they very frequently have it. And so it may be demonstrated in an increase in their pacing, an increase in their perseverative talking, an increase in their self-stimulatory or perseverative behaviors, avoidance. You know, we see a lot of individuals with autism spectrum disorder who very much want to avoid the situations that are anxiety provoking. So the combination of autism spectrum disorder, anxiety, and ADHD is very common. And as a clinician, again, I want evidence that they don't exist. Yes, I want evidence that they do exist, but if I go into it looking just for evidence that it does exist, I'm going to miss the symptoms of anxiety and ADHD. So some of you parents may be saying, my child doesn't have tantrums, he or she has rages. So one of the most, over the past few decades, what we've seen is that the individual with autism who is having the most difficulty adapting at home, adapting in school settings, adapting in social settings, has not just autism spectrum disorder and ADHD and anxiety, but may also have a disruptive mood dysregulation disorder. And I could do a whole 3-hour webinar on DMDD, but think of DMDD, disruptive mood dysregulation disorder, as children who have rages. They go from 0 to 10 very quickly. They are angry and irritable much of the time. DMDD is classified as a depressive disorder. So these are children with or without autism who are kind of like Eeyore. They see the glass half empty. They think I can't rather than I can. They quickly go into fight or flight mode. And I think that in school settings, children with a combination of autism spectrum disorder and DMDD are often the most challenging because they go into fight or flight mode when they're asked to do things that they perceive, they can't do. Now, the adults may perceive that they can, but what's more critical is what the student perceives. So what about cognitive functioning? Certainly what we know is that individuals on the autism spectrum have a higher rate of cognitive or intellectual deficits. It is not something that is easy to talk about. And very often we see individuals diagnosed with autism, but their cognitive level is really never addressed. Part of that is due to the fact that a young child on the autism spectrum may not have the social skills, the language, the reciprocal interaction skills to complete formal testing. So they never have a test of their intellectual abilities. And then they just go on with the eligibility or the diagnosis of autism spectrum disorders. But we certainly know that the intellectual functioning or the cognitive level will impact the trajectory of learning and the child or school-age child or adolescent or adult's ability to function independently. So individuals with autism spectrum disorder can run the full gamut of intellectual abilities. We see individuals with autism who have what we now call intellectual disability, or what Article 7 refers to as a cognitive disability. We see individuals with autism spectrum disorder who have average abilities, and we see individuals with autism spectrum disorder with intellectual giftedness. So understanding an individual's cognitive level is very helpful in especially determining what are appropriate goals and expectations for learning. So can a person with autism spectrum disorder have a specific learning disorder? So clinically, we refer to specific learning disorders. In school program, we call it specific learning disabilities. So what we again know is individuals with autism spectrum disorder actually have higher rates of learning disorders or specific learning disabilities than those in the general population. Those who have early language deficits are at higher risk for trouble with language and reading. Disorders in this area are often fall into the category that we call dyslexia. They have, I think, people without early language problems, but also those with early language problems often have a lot of difficulty with written expression, getting things down in writing, their handwriting, their spelling, generating ideas for writing. And then those with autism spectrum disorder can have math learning disabilities. So again, oftentimes evaluations stop short at looking at the cognitive functioning or whether there's a specific learning disability, but often we'll find that the behaviors that an individual has around school, around homework, are related to their learning difficulties. So how do we find out what else is going on? Well, I think as a parent or a professional or an educator in this area, you need to educate yourself on coexisting conditions so that you know what questions to ask. So you know to say, I'm worried that my child may have an anxiety disorder. I'm worried they may be depressed. I'm worried they may have a learning disability. The only way to answer some of these questions is to request a comprehensive evaluation. And that can be done through the schools or outside of schools, but you have to be very clear with whoever you're requesting it of about what you want explored. In other words, what are your concerns? And then I think it's important to consult with a professional with experience with autism spectrum disorders and learning and or psychiatric conditions. So you could go to professionals who treat anxiety, but if they don't understand autism, it's going to be hard for them to know how to treat anxiety or depression. So you have to make sure you're dealing with people that have some knowledge of autism spectrum disorders. And once you have answers or a better understanding, continue to educate yourself and others so that they may know better how to intervene with your child or the person you're involved with. So I've put together some recommended websites for families or educators or other professionals. I like these websites in particular because they deal with a wide range of issues that impact children. They have very good practical information. They have good overviews of various conditions. The first one on the list, CHAD, is actually designed to address ADHD, but they have information about a wide range of conditions that coexist with ADHD, including autism. So the others, I think they have good videos, good articles, and I would really encourage you, if you have a concern about one of these areas we've talked briefly about today, to go to these sites. You notice I didn't include autism specific websites because I think most of you know about those, although each of these will have information on autism spectrum disorders as well. And then on our website, Children's Resource Group is the name of the group I'm with in Indianapolis. We have a number of articles and webinars that are available for families. We have quite a few on autism spectrum disorders, but we have them on anxiety, DMDD, ADHD, anxiety, depression, learning disorders. So, I don't mean to put Children's Resource Group in the same category with some of those other websites, but we have some information as well.